I'm a primary care doctor taking care of a large group of patients with very complex health and social needs. And ever since I've understood the triad method of understanding my patients, I can't imagine practicing without it. Ultimately, what I find so satisfying about triads is that it allows me to understand and connect with patients, and they feel that. And when they feel safe and connected to me and trust me, they're willing to reveal themselves to me. And what they reveal turns out to be far more important than what I came into that room thinking I was going to do. What they reveal about the medicines that they're not taking, about the people that are hurting them, about the substances they may be using that they haven't talked to me about, or about any number of different stigmatized or shameful things that if I know and they trust me to share, I can then make a much more meaningful difference in their life and help them overcome many of these chronic conditions that I feel like I'm just chasing my tail, treating, instead of really dealing with what's driving them. So to me, distress in the TRIADS model are most of the symptoms and conditions that my patients present to me with every day in primary care. So trauma is not everything. It doesn't explain everything. But so many of my patients' symptoms and illnesses are related to the distress of trauma. Obesity and diabetes, lung disease, liver disease, kidney disease, depression, suicide, substance use. All of these conditions that are so common in primary care are known to be correlated with individual, family, community, and historic trauma, what we call adversity. Understanding that helps demystify my patients to me, helps me understand why they're not taking the medicines that I've prescribed, helps me understand why they can't stop smoking despite severe lung disease or even lung cancer, helps me understand why my patients might be really reactive or angry or really defensive and regress in clinic. And that understanding helps me be more patient, helps me be more compassionate, and ultimately helps me have a much better experience taking care of my patients and much better outcomes of care with my patients. Strengths is the third spoke of triads in addition to distress and adversity. And to me, strengths start with appreciating that that patient with so many different conditions has shown up that day in clinic. Oftentimes my patients are black or brown, and I'm a white male physician. Oftentimes they don't even speak English, and they've still come that day seeking care from me. And I understand that first, that act of coming in for care, as being a strength that I appreciate in them and I point out to them. But the strengths are also something, if I understand them more deeply, the degree of their strengths, their individual strengths, their family and relational strengths, and their community strengths and resources, that if I know, I can then harness with them to help them overcome the adversities they're experiencing and help them overcome their illnesses, and do so in a much more positive way than just focusing on their adversities. In order to really know someone's strengths, you have to play with them. You have to joke around with them. You have to be personal. You have to break down that whole barrier of I'm a doctor and this is a patient, because especially if they're different from you, because you won't really understand their strengths, because you won't understand them culturally until you get to know each other. And when that happens, you actually see change. You actually see outcomes of care that are better. People heal. You feel like what you're doing really matters.